Almost a year ago, it was January of 2024, I had found a lump that we ultrasounded, subsequently removed the lump, and the pathology came back very unexpected. I was a triple negative breast cancer patient at that point. My life changed drastically because I felt like I had my whole future in front of me, but when this news hit, everything stopped. I couldn't think past getting treatment.
The way we take care of those patients is we do what we call fertility preservation. And that's a way to help them maintain their fertility potential even later in life if things tend to go towards a higher risk for infertility.
After meeting with our oncologist, she asked us about our future fertility. And of course we wanted kids, but we were thinking that that was 2 years down the road. So at that point, after having a diagnosis, all that in our minds, that was put on hold. So knowing that information, she referred us over to Dr. Rushing and the UMMC Reproductive Endocrinology group. We could not have been more satisfied with our treatment and the guidance that Dr. Rushing gave us as we were embarking on this new journey that we had no clue what the outcome, or we had never even planned for this to happen to us. After meeting with Dr. Rushing, we discussed our options to preserve my fertility, first by saving my eggs, and then secondly by suppressing my ovaries while I was receiving the gonadotoxic medications, my chemotherapy.
The other term that I think about with fertility preservation is what we call oncofertility. And they've got that term for people that have an oncologic diagnosis of malignancy, and they're going to receive medications that are going to significantly increase their chance of becoming infertile. One of the ways that we help patients in that situation is by trying to maintain their fertility, and that can be done different ways. That potentially is just medications to suppress ovarian function to try to decrease the uptake of these gonadotoxic agents, or the most effective way, if the patient has time to do that, is by freezing eggs or potentially embryos.
I didn't realize that saving my eggs was even a possibility until talking with Dr. Rushing.
So why would someone want to freeze their eggs? We just heard Kaylee's story about the process of receiving a diagnosis that's, life-changing in so many ways, and there's so many things that are going through her mind. These patients also have the future to think about with potentially losing the ability to have kids, and this is a way to try to maintain that potential and take that burden off their plate of something else that they don't have to worry about or think about. So I think it's a way to give them peace about the future and what lies ahead, and knowing that they've done everything they can to maintain that possibility in the future.
Now that I've gone through this whole process, I am eternally grateful. Just the fact that I know that I have the ability one day to have children of my own is so wonderful, and I'm so grateful. The care that I received from the Reproductive Endocrinology Group, or the REI clinic here at UMMC, was absolutely phenomenal. They streamlined the process. They're always available to answer questions. It was absolutely the best treatment, I think, that I have received out of all of my care. It was phenomenal.